Hi, it's Dr. Jeff here, and I want to set a record straight, and that is that age is not a disease. You know, all too often when it comes to an older dog or cat having a problem and someone discussing various options, treatment options, diagnostic options, and I hear, oh God, but he's so old. Well, we don't want to do that surgery because, you know, he's already 14. Well, let me tell you something. You wouldn't tell Grandma, who's 94 and fell and broke her hip, that, sorry, Grams, no surgery for you because you're 94. Age is a condition. It's something we deal with, but it is not in itself a disease. I would rather, for example, do surgery on a 14-year-old dog whose heart is great and whose liver, kidneys, pancreas, bloods are perfect, everything great, than a 7-year-old dog who's got kidney disease or renal disease, or liver disease. So you got to think of it that way, and that is that when we know we're dealing with an older dog, a geriatric dog or a geriatric cat, we make adjustments during surgery. We will have surgical fluids. We use maybe a different anesthetic agent. We might keep them a little lighter during the procedure, but they're being monitored, and we will hopefully do everything is going to go smoothly. I just did actually in like a week. We removed a huge tumor from a 14-year-old dog's leg. And as I was expecting, because of the tension, the suture line, we ended up having to come into a second plastic surgery procedure to do what's called a sliding patch graft, the skin graft, where we could slide some skin down to close the gap created by the removal of the surgery. So that required a second anesthesia a week later. And the dog is fine, got up, no problem. Now, if that client would have said to me, well, God, the dog is 14, and I don't think we should do surgery on a 14-year-old dog, this dog would have had no chance whatsoever. So when discussing geriatric pets with your veterinarians and something needs to be done, have a blood test done, have x-rays done, make sure that the pet is fine, and if the pet is fine, don't let age by itself stop you from doing what's best for your pet. Tune again soon. Bye-bye.